So when people think of healthcare, they think of full spectrum care around the whole person and their whole lives. But when you really look at the healthcare that we're able to provide, it's largely what we call ill care. It's a disease response system. You can't get in without having a diagnosis, a disease, or a problem. And when you look at how we train our healthcare students now, we're really training them to be disease responders because that's what they see. The culture has kind of evolved that way. The economics have evolved that way. And our hope is that we will evolve as health systems to really address people within their whole selves, their whole lives, and the worlds that they live in. So this bridge or transition from ill care to well care is not only one that is ideal, but it's one that is economically advantageous, if not urgent, because we spend more on healthcare than any country in the world, and we have some of the poorest outcomes. So there's a lot of work being done now around this issue of looking at what is it that we're missing and how do we try to understand how well someone is. And one of the interesting things that have occurred is that for years we really didn't have an outcome for wellness. You know, what does wellness mean? It's kind of a word that everyone agrees on, but no one really agrees on exactly what it is. It's been monetized and operationalized really for profit in many, many ways. The wellness industry is a many trillion-dollar industry, and often when you see wellness information, it's usually trying to sell you something. So to research wellness and really understand it, we need to put it in operational terms. And over many years looking at wellness, we've really understood that the observable part of wellness is really the resilience that we all have to withstand threats in our health and our function. Resilience allows us to either resist a problem or heal very quickly from a problem that we incur. We've looked at resilience now through the National Institute of Health that's come forward with a model of what the elements of resilience is, and the National Center for Complementary and Integrative Health at NIH has put together a 9-point scale called the Whole Person Health Index. And this index is really an index of wellness or resilience, and it looks at many different features that one would expect in a well life, as opposed to focusing on the diseases we have or don't have. So this index has been validated now by the CDC, and it's an index that we hope will be used to screen how well your life is and to give you a sense of where the strengths are and maybe the weaknesses are, so that we can change our lifestyles in ways that improve our longevity and our well-being.